Hi, my name is Brie O'Brien, and this is our guest, Rudy Christopher, founder and CEO of Integrity Physical Therapy and Wellness. And we're going to learn all about this impressive practice that's located right here in South Jersey. So, Rudy, tell me, what exactly is your background?
Well, Brie, first of all, thank you for coming out, and thank you for that kind words of impressive. So, my background, I'm born and raised in South Jersey. I grew up in Marlton, New Jersey. I went to Bishop Eustace High School in Pennsauken. Then went on to University of Notre Dame. I was fortunate enough to get in and graduate there. Went to Hahnemann Physical Therapy School. What's funny, I actually have a degree from Allegheny University. It's the 1 year that was Allegheny, formerly Hahnemann, now it's Drexel's program. Graduated in '98, been practicing physical therapy ever since 1998. Yes.
So how did this all begin, and why did you choose to create Integrity Physical Therapy and Wellness?
The company itself, Integrity, we actually just purchased an outpatient division from a practice I worked for over 10 years last April of 2015. It began basically, it's been brewing, I'll be honest, since 1998, since I started practicing. In my mind, I always felt the need to practice, learn, and eventually get my own practice, a company I can feel that's something I can coddle, create, and take it to a level. So short version of a long story is Integrity was created an environment, if I talk patient-wise, we try to create an environment where the patient's going to be treated personally and professionally. They're going to come in and be confident that their needs are going to be taken care of in a timely fashion. They're also going to feel part of a family. They're going to feel comfortable. They're not going to feel like they're being rushed. They're not going to feel like a number. I'm very particular about that environment I try to create. So from the patient perspective, that's why the company was created. From a clinician perspective, I've been in many different positions, a basic staff therapist, I've been a manager, a supervisor, a regional director, and an owner, and I've seen the pros and cons of different positions and different practices. So I'm trying to create an environment for my team that I try to beat them to the punch. I want to create an environment where they're feeling treated personally, professionally, appropriately. They're excited to come to work, and I never want them to come and say, well, you're not doing this for me. I'm trying to beat them to the punch. Every day I'm analyzing where the practice is, what are we doing, what am I doing right, what am I not doing so well, and that environment, I think if I can continue to create that, will be viable and we can be long-standing.
Right. And integrity, it's such a meaningful and powerful word, and obviously means a lot to you, and it's the core value of your practice. So why did you choose the word integrity to be a part of the name?
Well, if I say integrity to you, what does it mean to you? 2 or 3 words?
2 to 3 words. Something valuable, something that means a lot to me.
Right.
You take pride in it.
Right. Strength, character. You know you're going to be taken care of. There's no shenanigans here. There's no smokes and mirrors. From the first time the call that you make to being treated to the billing, like that is a way of life. It's a culture. It's not just a word. It's a culture that I've ingrained in this practice. So that's what I wanted to be. That's why I chose it. Our core values, our 3 core values. One is always do the right thing. No matter what it is, always do the right thing. Secondly, do your best. Always do your best. Thirdly, take care of each other. If we stick to those 3 core values, we'll be fine. We'll do well, be viable, and we'll continue to grow. So once again, that culture, based on the name, based on the core values, I mean, that's why the word integrity.
So what specialties do you have here at the practice?
All for our 4 operating clinics, which I don't think I've mentioned. We have a clinic in Northfield, New Jersey, one in Stratford, New Jersey, one in Cape May Courthouse, New Jersey, one in Ocean City. We offer many different specialty programs. One being orthopedics, sports. We also work with the geriatric population. We do soft tissue assisted mobilization techniques, very manual-based practice. Every patient walks in this door, we're going to get our hands on professionally.
Right.
I've been in practices where it gets to be almost like a glorified gym, a mill, where people come in, they say hi to you, they walk out, and they're done their program. You're not going to find it here. And that's a pet peeve of mine. And we always do training. I'm investing in the clinicians just to be the top notch in terms of programming, development, and putting a good product out there. We also do dry needling, which I have 4 therapists in the practice, which not many therapists in the state of New Jersey are doing it, but we have 4 therapists, which once again I'm investing in the practice and my team doing dry needling.
And what exactly is that?
Similar, the same needles that acupuncturists use, a little different approach, more physiological based. and we're getting some great results with it. When you speak with my coworkers, Bill and Ryan, they'll go in more detail about some of the programs they're doing it. I still treat. I'm still treating. I'm a treating clinician, not as much as those guys do.
You don't have to get your hands as dirty.
I get them dirty, but not as dirty as as the rest of the team. But that's another thing too. As an owner, as a physical therapist, this is a private practice owned by a physical therapist. You'll never see Rudy Christopher sitting in office throwing out commands, do this, do that. I'm in the field. I'm on the front lines with them, and I want to see what's going on, and I always will be doing that. So yeah, they'll definitely go in more detail. We have ART, OCS. So there's all the different specialty programs for the benefit of the patient. And what we're doing today, we may have to change next year. It's ever changing. What I was doing 10, 15 years ago, it's not being done.
The same.
You would come in. If you had low back pain, I put a hot pack on you, do some ultrasound, maybe light massage, a little exercise, and you're out the door. Yes, those modalities still have some place in the field of physical therapy, but more and more it's manual, it's core stabilization. It's a different approach now too, and now we have to stay on top of that.
So how does your practice differentiate from any other physical therapy office?
Thank you for asking that question. I'm not going to be biased, but once again, like I mentioned to you, I invest in our clinicians a lot. Very heavily based on evidence-based practice. So clinical excellence. When you walk into that field of clinical excellence, anything diagnosis walking, whether it's an older adult patient, a young patient, we're going to know how to deal with it, how to handle it, or not. I don't want to say every patient that walks in the door is appropriate for physical therapy. Sometimes the referral out that physical therapy might not be warranted at this time. We also are versed on differential diagnosis. You come in, I push direct access. In the state of New Jersey, we can practice direct access, but to get reimbursed by an insurance company, we need a referral from a physician. So I encourage people to take us up on our complimentary consultations, direct access. I was working out and I hurt my shoulder. Well, stop in, give a call. We're very open to being a resource, whether we can help you or not. Whether it is warranted, we can start physical therapy, or we may refer you to another practitioner. So we're very big on that. Clinical excellence, professionalism, presentation, going above and beyond the difference of what you're going to find in integrity. And I push that. That's the culture. I go back to the word culture. If we don't nurture culture, we don't continue to analyze our culture, do we need to change our culture, then you just become stagnant, and then you actually just start to fail. So I might be a little biased, but I've been around enough. There are excellent practices out there. I'm not saying integrity is the end all, but I'm going to push my team. I'm going to push myself. I wake up every day. How can I make myself better? How can I make my team better? How can I make this practice better? So when people come, they're going to refer.
I feel that.
Exactly. I have salespeople out there pounding the pavement, making the calls, doing things. But if I treat these people with the utmost respect that they deserve and do right by them, whether I treat them or not or take care of them, we're going to make some difference. But if we don't make the true difference, they're not going to want to come back. They're not going to want to refer their family or friends to me. So once again, the difference is they're going to come in, I'm going to take care of them or not, or I'm going to refer them somewhere else. Say, look, Mrs. Smith, I can't take care of you right now. You may be better versed to go somewhere else.
Right, and at least you're up front.
Exactly.
And you're telling them.
And then I'll come back 10 times to the practice, and I can put my head on my pillow and sleep at night. So that's the integrity difference. I might be a little biased. Once again, I've been around enough, and I think if we keep on doing that and we stay the course, we also do a lot of educational pieces. We go out and do talks. We go to communities, complimentary. We're doing talks on we do fall risk assessments. We do talks on osteoporosis, arthritis. We do functional movement screens on younger athletes. We're talking to parents, pitcher's elbow, those kind of things. We're out there in the community too. So it's not just sitting here, hey, come to us. This is a service that we offer to the community too. So that also makes us different too. We're very progressive, proactive, and getting our name out there and doing right by the community, because I'm never going to be a big corporate entity. We have to work within the community and grow from within.
Right.
All my clinicians are homegrown clinicians. They live in the area. They know the people. They shop in the same supermarkets that the patients shop in. So that goes a long way too. And the patients can feed off that and feel that community feeling. So that's the integrity difference.
Okay, so where's your practice today, and where do you see it going within the next 3 to 5 years?
When people always ask me how we're doing, well, we're not perfect, and the doors are still open. So we're in the middle of the road there. I'm looking at creating better efficiencies from when you walk into the front door. How are clients being received? How are clinic coordinators handling the scheduling, the phone calls? How are we doing with our practice? Our outcome measures. Are we getting people better? Are we doing what we say we're going to do? I live by the rule of exchange of abundance, and one of our quotes is, "We never promise more than can be delivered, but we always deliver more than is promised." And I want to stay true to that too. So I'm always looking at right now, what are we doing right? What's not so good? How can we improve upon that? So right now our current clinics are we're growing. We're getting our name out there, our brand recognition of Integrity. Like I said, it's only been around, Integrity's been around for a year and a half at most. So we're getting our name out there, our branding out there. We're making more contacts with different groups, support groups, local Parkinson's group, AARP, local athletic teams, athletic trainers. So we're doing different things too to get our name out there, and we're growing the 4 clinics. What I'm looking to do is, once again, when I feel that we will never be perfect, when we are at that point, I am also looking for growth opportunities, whether it be organic growth or acquisition growth. Integrity, the 4 clinics we have, 2 of the clinics were actually previous acquisitions that we had to put the culture in and get to the point where they are today. So currently, right now, I'm looking to do that, try to create efficiencies, systems in place, make sure we're doing everything right by the patient, doing right by the employees, and staying true to that word integrity, put the good product out there. And if there are opportunities out there to grow, whether it be in southern New Jersey,
Yeah, do you
within
plan
the
on
state,
expanding outside of South Jersey?
I would like to smartly. You know, not every business is a good business opportunity to get into. There's a lot of opportunities out there. But once again, it has to be a good fit for Integrity, the culture. If you don't have culture, if you don't have a right fit, you can find a business out there and say, okay, well let's entertain acquisition and stuff. But if it's not a culture that's been established that fits in line with our culture, it's not an opportunity I want to entertain. So, but there are some places out there. So yes, I'm looking maybe potentially, if we get an affordability factor, if we can find an acquisition or some organic opportunities too. It depends on the referral source, depends on the area, location, those kind of things, if that makes any sense.
All right, thank you, Rudy, for taking the time out and telling us all about your background. It was a very fascinating story.
Thank you so much for your time. Greatly appreciate it.